Hello everyone. We have a 50-year-old man who come to you for a routine checkup. He's a diabetic and at the moment he's concerned about the end organ damage due to diabetes mellitus. Although he has no problem as of now. Now, earliest renal abnormality to be present in this patient is a beautiful question. Well, the right answer is E, glomerular hyperfiltration. Well, this is the earliest renal abnormality present in patients with diabetes mellitus. This means normal GFR is 126 per minute. But in these cases, GFR may go up to 140 or 150 also. That is the stage of hyperfiltration, or you can say, same thing we can say, increased GFR is the earliest feature. This can be detected as early as several days after diagnosis of diabetes was made. This is a major pathophysiological mechanism of glomerular injury. That means whatever injury which has happened in the advanced stages. Remember, diabetes is the most common cause of end-stage renal disease in the world. But this is the last stage. But it starts with the glomerular hyperfiltration. This is the beginning which leads to glomerular injury. Now, it creates intraglomerular hypertension. This leads to progressive glomerular damage and renal function loss because of what? Intraglomerular hypertension. We know very well that ACEI, they are very effective in diabetic patients. Okay, especially early diabetic nephropathy, because they reduce intraglomerular hypertension. That's the advantage. So that's a drug of choice for diabetes with hypertension, because not only they control the systemic hypertension, they also control the intraglomerular hypertension also. So they decrease glomerular damage. Now I have some question for you. Stop the video, write down the answer. In diabetic nephropathy, what is fibrin cap, capsule drop and Armani-Epstein reaction? Stop the video, write down the answer. Well, in the diabetic nephropathy pathology, capillary basement thickening is an early feature. And after that, there is diffuse glomerulosclerosis. This is the most common pathology. In this, there is an increase in the mesangial matrix, and it is positive. Then we have nodular glomerulosclerosis is the most characteristic feature. It is accompanied by accumulation of hyaline material. And this, if it is within capillary loop, we call it as fibrin cap. And if it is attached to Bowman capsule, we call it to be capsular drops. As far as Armani-Epstein reaction, collection of glycogen clumps within the renal tubule is found in the diabetic nephropathy, and this is so-called Armani-Epstein reaction. So now let's look into the picture. Green arrow, this is formed by, this is so-called hyaline cap, green arrow, okay? Well, then we have this mesangial nodular deposit, positive material. Then we have a arterial hyaline diffuse type of nephropathy, glomerulosclerosis, and this is the nodular. This is the nodular sclerosis is there. Lovely pictures. Capsular drop. Look into this. This is hyaline degeneration, so-called fibrin cap. Now let's look into other option A, B, C. So now we are clear about it. They are the one which come later on. Okay, thickening of GBM is the first change that can be quantified pathologically. It's followed by mesangial expansion and nodal sclerosis is superimposed later on, as we discuss. The first thing is hyperfiltration. Immune deposit is not a feature of diabetic nephropathy. It is seen in condition like SLE, which is in fact the autoimmune disease. This is more common. Otherwise, immune deposition can occur in membranous glomerulonephritis. Golden line to remember: glomerular hyperfiltration is the earliest renal abnormality seen in diabetic nephropathy. GFR is increased. It's also the major pathophysiological mechanism of glomerular injury in these patients. Thickening of glomerular basement membrane is the first change that can be quantified pathologically. Remember, this which can quantify pathologically. This is a physiology, increased GFR. So remember the two different questions. First feature is hyperfiltration, but if we talk about quantification, then thick basement membrane is the first thing to happen pathologically. Thank you very much.